So my name is Senta Curran. We own the George Thompson Agency right across the street from the custard stand.
Where that is?
Right up at the red light,
Okay.
right?
I don't know where anything is.
Oh, okay.
Two houses down.
You're new? Oh, okay. So we do Medicare, we do other things. I'm a CFP, a Certified Financial Planner, and I have an MBA from Baruch. So let's start, and you can ask any questions you want. I'll try to answer them. If I can't, we'll find the answers for you. So this is just the basics on Medicare, and you can tell your friends, you know, if you have friends and they're aging in, they always have a lot of questions. You can flip it. All right, it's the National Health Insurance, so you're paying in a sense for your Medicare. Are you in Medicare Advantage plans or are you in supplements? Do you know?
Advantage.
I'm not yet.
You're not.
I
Okay.
have a phone appointment with Social Security to start signing up.
Okay, that's good. That's good. You can do it online too.
I couldn't. I tried.
I know it's difficult. All right, so that's good too. So it's for people 65 and over, but sometimes people are disabled, and after 25 months of disability, you can get Medicare, even if you're younger, which is good because or if you have kidney disease, you usually get it like within a couple of months, or Lou Gehrig's, but nobody wants those, so not at all. You enroll through the Social Security Administration, just what you're doing. If you were employed and you turn 65 and your employer, if your employer is a group of 20 or more, you don't have to sign up for Part B, but we'll get into that. Okay. So these are the 4 parts. So for you, Part A, Part B, Part C, and we'll go through them. Part A is your hospital, and you have a deductible for that. It is going to be, let's see, did I write it in? I think it's like $1,111 or something like that. That would be if you just had straight Medicare. And then you have Part B, and that deductible will be $164.90, so it's dropped from last year. And then you have Part C, which is the Medicare Advantage plan.
Mm-hmm.
So let me explain a little bit about the Medicare Advantage plan. Medicare, you have to have A and B in order to be in a Medicare Advantage plan. You can't be in it without it. The government, back maybe 2006, they were experimenting with it, decided it might be cheaper for them to pay an insurance company to manage your care than for them to have the Part A and B and manage your care. Because all the claims, original Medicare, pass into Medicare, they process them, and then it goes to the supplement, or if you have one. Otherwise, it goes back to you, and you pay, you know, the remainder of what the 80/20 that Medicare picks up, and also the deductible for the hospital. So Medicare Advantage plans are Part C. They're driven by a zip code. That's why Joe Namath always says, and give us your zip code. So certain counties have certain plans. In our area, we actually have Aetna, say, WellCare, MVP. There's quite a few Medicare
Is it
Advantage.
different between Orange and Ulster?
There can be.
Okay.
Most of the time it's Orange, Ulster, and Sullivan. Sometimes Sullivan doesn't have as many. Companies will come and go because if they don't make enough money, because they are an insurance company, they're not the government, you know, they can just,
Profit driven.
yeah, yes, they're profit driven. They will pull out of our area. Like Emblem this year is taking some plans out of our area because it just didn't work for them. So that's your Medicare Part C, and then you also have prescription drug coverage. So if you should go into original Medicare, which would be your Part A, say you're aging in, you're going to get A on a card and you're going to get B. No matter what, if you just wanna do it that way, you can do it, but sign up for Part D, otherwise there's a fine. And it's 1% per month for every month that you should have had it and you didn't have it. And then it's times what they use as a premium, just an average premium. And it follows you for the rest of your days unless you can get on low income subsidy. But if you're employed and your company has credible coverage, you don't have that because you already have prescription drug coverage. And people always ask me, why do they do that? Well, law of large numbers. We need people in our pool for prescription drugs. Otherwise, we would only have the sick people have prescription drugs. And the well people wouldn't sign up until they need it. So that's why they do that, okay? It's not a punishment, but people view it as, why should I don't take a prescription. Well, that's good, because there's a lot of people that take a lot of prescriptions, so we need your money. Right?
Everybody needs your money.
All right, so this is original Medicare. Part A is your hospital, Part B is your doctors. Now this next year, your Part B deductible, I want to get it exact for
22 or
you.
23?
For 2023 will be $164.90 if you're in original Medicare, not in your Advantage plan, totally different. We'll go into that after this. And your Part D deductible, and that's your drugs, the highest it can go is $505
For a year.
Yeah, and that's usually for tier 3 and 4, meaning like the Eliquis and all the commercials that you see. Those tiers are usually tier 3 and 4. They're very costly. Tier 1 and 2, in most cases the deductible does not apply and it's first dollar coverage, but they get you in the others. So when you see them
My husband's
advertised,
diabetic, is that what tier with the insulin?
tier 6 is for insulin, and that's different tier. Now most of those are like $5, $11 right in there. They're not that expensive. If you go to Ozempic or something like that, then it becomes more costly, because that again is an expensive drug. So that's that one. And then the Medicare Part C, which you have, the Advantage plan, everything is all in one. She has her hospital, she has her Part B, and she also has her prescription
I
drug
don't
plan.
think I have prescription.
You don't?
I don't think so.
You should. You
Yeah,
should
right.
have do you have a prescription?
Just paid $20 for something.
Well, it's not, yeah. You're always going to, in most instances, have a copay.
It depends where you buy your prescription.
Right, you
When I
have,
got it at Fry's food store in Tucson, I didn't pay anything.
right,
When I got it at
Hannaford.
Hannaford, it was $20.
right.
So I don't know.
Yes, if it's a preferred pharmacy, and we always look for the preferreds, which is like Walgreens, CVS, the big pharmacies. Hannaford's can be preferred too. You will pay less. You will pay the preferred
Less?
copay, less.
I paid more.
If it's
Is that just
not,
for Advantage plans that there's preferred?
nope, for both.
Okay.
If it's not a preferred pharmacy, you pay more.
How do you know what's preferred?
Because when we enroll you, we tell you which pharmacies are preferred for that particular plan. The Advantage plans, we have to get all of your doctors, all of the hospitals that you use, and your prescriptions, and then run them to make sure that the plan fits where you are. Because sometimes doctors drop out.
You can say that again.
So
Like Chris-
the Advantage plans dictate which doctors you can use?
Well, they have a network. If you leave the network, do you know the difference between an HMO and a PPO?
No.
Okay. An HMO is you have a specific network, and those doctors participate, they have their negotiated rates, and you can go there. If you leave that network, say you want to go to some doctor down in New York City, he says, I don't take whatever plan it is, then you're going to pay the out-of-pocket cost. So that's how an HMO works. So it's a specific network that company, United Healthcare or anybody, Aetna, Cigna, whatever, has negotiated with. It's the same way with an employer plan. Usually you have a specific network, and then you also have the out-of-network option, but you're gonna pay more. That's how they contain their costs. A PPO says, okay, we have this network of doctors, and if you go there, we're gonna give you, like a little bonus, and you're gonna pay less of a copay. If you go outside of what we've negotiated with, you're gonna pay more. But it does allow you to go in and out of network, so it gives you a little more
I
freedom.
find that where I'm living now, where I was living before, there's not enough doctors in the POP.
Where are you,
I came from Tucson,
now you're here?
down here.
Okay, and where are you living here
Well, my address is Wallkill.
okay. Yeah, well, we have big places like Crystal Run, right, Horizon, all of those places.
What are they, like urgent care places?
No, they're large amount of
And
doctors.
in Pine Bush?
In Pine Bush, we have a small little urgent care, right down on Boniface Drive.
And is that a POP or a?
Well, you'd have to check and see.
If it was, that would be the only one?
Well, yeah, but you have other ones. You can go,
Well, you can go if you know, but I don't know.
Right.
So is everybody in Crystal Run all in the same?
Yes. In groups usually like that, the whole group either takes it or they don't. So in Crystal Run, if you go on their website, you will see that where they have pulled out of certain plans. So say as of January 1st, we no longer take blah, 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 and then you know that you're gonna have to change. If you wanna go and continue with those doctors, then you're in Medicare Advantage. The benefit of the original Medicare is you can go to any doctor or hospital in the United States that takes Medicare. You would have out-of-pocket costs, so that's where you purchase a supplement. So let's go into the next
Okay,
one.
so you can purchase a supplement without getting an Advantage plan?
Yes, you don't need it. It's actually, you cannot have an Advantage plan and a supplement at the same time. It's illegal.
But the supplement is more costly, isn't it?
In the initial starts, you pay more for it, but your copays are, say, I'm just gonna give you a plan, they go from A to K, the supplements do. They're standardized across the nation basically, except for a couple of states. And what we do is we go into the Department of Finance for New York State and they publish all the rates. So you can pick the one that you want. You don't have to have just one company. There's a bunch and their rates vary. So we always take the cheapest. You're getting the same coverage,
Yeah.
so that's how we do it. And they will pick up the cost, depending upon the plan that you get, of what Medicare doesn't cover. Okay, like the Part B deductible, $164.90. If you're in original Medicare and you go to the doctor starting January 1st going forward in 2023, you will be responsible for the first $164.
That's each time you go?
No, just once.
Just once.
So
it's a
once,
yearly thing.
yes, and then that bill will go, the doctor will send it to Medicare. They will process it, and then if you had a supplement, they would send it to your supplement and they would process it. So if you have certain plans, you're gonna pick up the first $164.90 of your doctor's visits. And if you're hospitalized, you're gonna pick up like $1,100 and some dollars.
And that's yearly?
Well, that's in a 60-day window.
Oh.
But if you have a supplement, most of them will pick it up, or at least 50%. And if you're hospitalized in a Medicare Advantage plan, you have copays. So usually they run $250.
So if you're in original Medicare and you're hospitalized twice in 1 year, you'll have the $1,000 deductible twice.
Well, it depends. It depends, because it does follow a 60-day window. And if it's for the same thing and you're back in, many times it's because they should have taken care of it the first time, but it just depends how it's coded. That's how they do it. So those are and you have to have a Part D, you have to have a prescription drug plan. and they range from $7.10 up very high, like $100 a month. They could go as high as that, and it depends upon your prescriptions. Most people, take very generic prescriptions. So, all right, next one. Okay, so we don't really have anybody in the group, but we all have a flyer, right?
Pretty damn.
Yeah, so what we'll do is we'll give you, and if you have a friend or whatever, and they're working, a lot of people make mistakes. They're still working, they're turning 65. They don't sign up for Part B, but their group is under 20. They're fined when they go to sign up.
Yeah.
Okay, so you have to know the rules, and a lot of people just don't know the rules. If it's over 20, you don't have to worry about it. You can stay on their plan and you're going to get A anyway. So that's very important. But you must enroll in Medicare at age 65. Okay. You pay late, they fine you if you don't, like they do with the drug plan, all right? And if you don't have Medicare, like sometimes people only have A, they don't have B, they didn't sign up because they didn't want to pay the money for it every month because they do take money out. This year, for coming year, it's going to be $164.90, so it's going down from $170. It was $170.
You have a month after you turn 65 to get signed up, right?
3 months before, the month of, and 3 months after. Okay? But we tell people to come into the office the month before or even a month before that, so we can get your prescriptions and your drugs and
So if I want to try to get an Advantage plan, then I have to list all my doctors. And
yeah, if you give the doctors, to whoever you go to, and your prescriptions, they put it in and type it in and start to check and see if your doctors participate and if your prescriptions are covered or not covered. Because some companies will cover a prescription and the other company won't. It's who they negotiated with to get the best rate. So we always have to look at that and make sure that everything is covered and that it's the best plan for you. All right? If you're receiving Social Security and you turn 65, you automatically get your A and B. If you're not, that's where the problems come in. Then you have to sign up for the Part B, because they don't send it to you automatically. You're not in the system because you're not collecting Social Security, all right? And it always starts on the first of the month. Oh, normally it's people sign up and say if your birthday was November 10th, it would be effective for November 1st. So it's always the first of the month. If you wait a month, then you have to wait to the next month. So that's why I say try to sign up when you are turning 65, even a little before. All right, and this is just initial enrollment period. You do have special enrollment periods, so I just want to make you aware of that. EPIC. Anybody familiar with EPIC? EPIC is the Elderly Pharmaceutical Assistance Program in the state of New York. We sign everybody up for EPIC that's qualified. If you're a married couple, it has to be 100,000 or under, and if you're single, 75, I think, and under. By signing you up with EPIC, you can get a special enrollment period, meaning you sign up for a plan and you hate it. Normally you're locked in for that time period until they have an enrollment period. With EPIC, you can get a special enrollment period, you can leave that plan and go to another. You get a one-time
What was
deal.
that first figure, your income?
Yes, so they go by income. Because what they do is they assist people with their prescriptions.
Yeah.
Some people have prescriptions that cost $900.
Okay.
All right, so then they kick in so that the people will get their
But it's just-
prescriptions.
Based on your income.
Yes.
Not on what you have in the bank or.
Right, it's your income.
Okay.
And if you're married at 100,000 or less, you're,
I would be eligible for that, I don't have that.
right. If you're single, it's 75, I think, thousand or less. And we keep the forms in the office and fax them
I
up.
never heard about it.
Well,
It's only New York State. That's
yeah.
Well, yeah, I'm back in New York.
Right.
Yeah, other states have some programs like that, but New York has a pretty comprehensive one that assists people. So that's Epic. So sign up you have to be 65.
Well, I'm 82, so I
Qualify.
qualified for quite a while and didn't
Just
know
made
about it.
So this is before the month you turn 65. If you sign up, you see it starts right on when you're 65. The month you turn 65, it goes to the next month, and then it gets 1 month after you turn 65, 2 months after you sign up. So then they make you have a longer window. So that's why it's good to sign up right as you're aging in, they call it. And then 2 or 3 months. 65, you have 3 months after you sign up, so then you have to wait. So this is the initial enrollment period. This is what we talk. This is for people that are working or whatever, and if they're collecting Social Security, they're going to get their A. Otherwise, you sign up for A. You call them up and say, I need A, but I don't want B. You can do that. If you're working for a company that's over 20 people, you don't have to take B. You can hold off till you leave, and then because people don't want to pay the additional money for it. And B is your doctors, your labs, anything outside the hospital. Okay? Yeah. If you're not covered, if you're self-employed, you're on COBRA, you have to sign up. So anybody that's COBRA'd and turns 65 and doesn't sign up is going to get a fine, and they're going to have to wait till January, and they won't become effective till July. So sometimes people can go 18 months without health coverage because they were covered under COBRA, so they assume that they had coverage, but Medicare doesn't view it that way. So then you end up with a penalty, and you have to wait. So it's expensive. You have to sign up for Part D, but in a Medicare Advantage plan like you have, it's automatic. I'm sure you probably have it, you just,
Can you tell from my card?
yeah, let me,
We'll connect you with some doctors too. United Healthcare, Medicare Advantage, Choice Plan 1, Regional PPO.
yeah,
So that's a good one.
you have
Alright,
prescription
So that means
drug.
I have prescription.
Yes. See right here, look. Medicare
Yeah, I
Rx is
saw
right
that,
there.
but I think this is on every card, but it doesn't apply to every.
No, that's your group number and your BIN number.
Alright, so.
So you're all right.
So I pay $20 for check, shouldn't I?
So we can look and see if there's something better.
Okay,
If there's somebody who will,
there's not many doctors either.
can you go to Middletown?
What?
Can
No,
you get
I
to- No?
don't drive that far.
You don't
I'm
drive that,
on my way.
Okay,
okay.
we can talk about that.
Yeah, you can find people in
Yeah.
Wallkill
Yeah.
or around there. All right. If you're covered again, then you have a special enrollment, but we can skip that because it really isn't applicable. It's for more bringing it into employer groups where people are starting to age in and then they don't want to take the plan or whatever, but they need to, so that's why. You don't want late penalties, but you don't have a late penalty, and you won't have a late penalty.
Try not to.
But we do get people in the office that didn't even know they had to sign up. You know, nobody informed them, and it's very difficult. Some people don't have computers,
Or know how to use
them, right? So they don't Google and say, well, am I supposed to sign up? They don't go to the doctor, so, you know, it's not a big deal to them, and they don't take prescriptions, so to them, why should I sign up? But you should sign up because you don't wanna pay the 1%, you know,
Yeah, I
per
had to
month.
pay that, when I took this United plan, I had to pay that penalty.
Because you hadn't signed up before,
No,
or,
because I had a different plan, I had Cobra,
okay. Yeah.
I had Cobra for life. Because it was a police department,
Mm-hmm.
but I was paying $200 a month and I never went to the doctor.
Right, right.
So that's why I switched, because 2 or 3 years of paying that, it was ridiculous.
Yes,
To have
yes.
vacation.
Yeah, so then you know what I'm talking
Yeah,
about.
more or less.
Yeah. You do get the penalty and,
Yeah.
you have to pay it, and it stays with you. Unless you can get like low income again, and that's difficult. So this is what happens, if you sign up during these months, January, February, March, your coverage will begin in July. So July 1st, anybody that was COBRA and didn't sign up, they have to wait to January of the next year, January 1st, and they can sign up. They then have to wait till July before their coverage becomes effective. So, you know, you don't wanna do that. Initial enrollment is what you're in. Special enrollment is what we were talking about with the EPIC. Right now, we have special enrollments in New York State. We have polio and monkeypox. So they send us when there's special enrollment periods, because sometimes you get into a plan that you don't like, or your doctor left, and that way we can change you mid-year.
Get you some water?
No, thank you.
There are enrollment periods. Right now, we're in the annual enrollment period, so anybody can make a change to a different plan. You can do it every day if you want, and on December 7th, whatever you're in becomes final, and it goes to at January 1st. In a Medicare Advantage plan, you also have OEP. It's called Open Enrollment Period. That goes from January 1st to March, the end of March. It's 31 days in March to March 31st. You can change again, one time.
So my husband turned 65 last year and went to the Office of the Aging for help, and they said that it was because of the COVID, it was he had to stay with the insurance that he was with for the time being until the emergency blah 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 got canceled. No, huh?
No, we enroll people with COVID and during COVID.
Okay.
Is he enrolled now?
He is, but he wants to change.
Okay, so he can make a change now.
Yeah.
Yeah, it's not a problem. He can change, like I said, he could change every day if he wanted to, till December 7th. And on December 7th,
It's locked in.
it's the lottery ends.
Okay.
So that's why you see all those commercials, because
Yeah.
everybody's advertising different things because they want you. So you sign up, say, for company A, and then you decide company B is better. You can do that. And then you decide company C is better. You can do that. And then when it ends on December 7th at midnight, whatever you're in, you're in.
You're in. Okay.
And then it starts January 1st. In a Medicare Advantage plan, you can change again one time for 3 months.
Okay.
Then you're
So
stuck.
many rules.
And then they have all these special enrollment periods. We had gun violence,
Flood,
flood,
FEMA.
yes, monkeypox, polio. So you have special enrollment. So you always need to check. You're not necessarily locked into a plan that you don't like.
It does seem overwhelming, but there's
It
a
is
lot.
overwhelming.
Yeah.
But if you work with someone like Santa, there's a lot of freedom and there's a lot of choices.
There are.
It's just all coming at you at once, but if you sit down and really
Yeah.
look at it, you're not stuck.
And they hound you on the internet.
I know.
They have you
Don't,
everywhere,
yes, yes. I mean, we don't charge, you know, we're not paid by you, we're paid by the company that we put you in. But, you know, some of them they have people that call and then you go up over the phone and sign up. We don't do that usually. We just sign people up, you know, and the officer come to their house and sign them up.
How many different Advantage plans do you represent?
We represent everyone in our area.
in the area.
We search for
A lot. She
A
worked
lot.
hard to be certified in
probably 10.
Aetna, United Healthcare, WellCare, Empire.
Fidelis,
So
Emblem,
there's like
Humana.
Humana, right?
Yeah, we have
Humana.
Humana.
What about AARP? Is
We
that-
have them, that's United
That's
Healthcare,
United.
and then AARP, when you say AARP, that's the supplement.
Okay.
They're like
So
two
Humana would be an Advantage plan and AARP would be a supplement.
but United Healthcare is a Medicare Advantage plan, that's what
Okay.
she has. So, most of the companies have, they carry a prescription drug plan separate, you know, where you just buy it outright and put it with your supplement or put it with your A and B. And then they also are in the Medicare Advantage plan market. And quite a few are also in the supplement market,
Okay.
okay? So, not all, but they have supplements and they carry it in different,
Is this supplement by area also?
well, the price is by area,
Okay.
okay? So, if you're closer to New York City, it costs you more,
Okay.
because the doctors get paid more.
Why?
The hamburgers cost more there too.
Everything costs more there. Because Medicare, I think, pays according to where we are, and so doctors get more compensation. This is original Medicare, this
You know
isn't the
what?
Medicare
Doctors-
Advantage.
Most of the doctors now, I've been going to physical therapy here. Medicare allows 200 and something for a visit, and they charge Medicare 100 and something per visit, and I have to pay $40. They get so much money for me walking on a treadmill or something. I mean, it's ridiculous, the money they charge, the money that Medicare pays out.
I know.
It's ridiculous.
But then the doctors will drop out of Medicare. You can't go to a doctor that doesn't take Medicare.
They are crazy.
They have to always take
Don't
Medicare.
most of them take?
Yeah, they are, but slowly some are leaving Medicare.
Are the fees that are paid to Medicare from the government the same in every state?
No,
So New York is probably very high.
yeah.
Because we're one of the richer states.
And our, you know,
Because we pay for the other states.
Yeah.
So that's why everything's higher here.
It's so confusing.
it is confusing. They make it, well,
Yeah.
they don't make it confusing, it just becomes,
All of the government is confusing.
But it is a good system. Like, you look worried, you don't, like, it is a really good system.
it is. I'm on it,
It's-
it's,
I wish we were on it. I wish the whole country.
well, no,
were
you
on
don't wanna be old.
it. No, but I mean, I wish the whole country, because then it would be
Yeah.
one system,
Yeah,
everybody
right,
would get
right.
it, and so it's just a matter of muddling through this part. But once you get there, it's good.
It is, and it is a muddle, it's like signing up for Social Security, you know, when should you sign up? Should you delay you know, all of those
Yeah.
things. So,
Well, I have to sign up for Social Security to get Medicare, correct? I thought that was like step one.
You just have to get the Medicare card.
right, they'll give you a.
No, but I have to deal with Social Security to get a Medicare card.
Yes, so for whatever reason, Social Security is also our window into Medicare. And I think that's because most people, unfortunately, will take their Social Security at 62, so they're already in the system. At 65, the card is sent to them
Well, I haven't
automatically.
worked outside the house much, so my husband.
Yes, you're on his,
Yeah,
50%.
yeah. Okay.
And your Part B premium will come out of your Social Security if you're getting Social Security. Otherwise, they'll bill you. And if you're a higher income, do we have the IRMA? Did they put in IRMA? I don't know if they- Here it is. Just, not that it affects but some people it does affect. See the income levels, single and joint? For single, $91,000 and over, you will pay more for your Part B. As it goes up, so if you're a real high wage earner, over or greater than $500,000 for a single and greater than 750,000 for a married couple, you will pay $692.20, not $166 like we pay. So you can get it. You can, yeah, but there are people that end up doing that. You know, both of them retire, they have pensions.
And if they have private insurance, they might as well keep that.
Well, but they still have to sign up for Medicare at A and B, no matter what. They're gonna they need the pool, so that is just what we call it IRMA, but it's income related adjustment amounts. So it does affect the higher wage earners.
Back or forward?
You're gonna go, okay. Deductibles, so this is for Part A, this is from 2022, this is current. If you only had original Medicare and you were hospitalized per spell of illness, it would cost you $1,556.
The hospital.
Yes, that doesn't, you can stay there 10 days, you can stay there 20 days, that's what you're gonna pay. Medicare Advantage plan, you're gonna pay a copay per day. You're gonna pay like $250 a day for the first 5 or 6 days.
But you wouldn't have the deductible.
Right, you don't have this, so, you figure it out. 5 times 250 or whatever, it's almost equal to the deductible. That was the Part B. Last year was $233, this year it's going down, not by much. Certain things it doesn't apply to our physicals, well visits, and most shots. And this year I believe shingle shots are also included in that,
So now, if an Advantage plan can have dental and
Yes,
and
yes,
eye,
yes.
whereas the original
doesn't have any of it, yes. And there's some plans that give, you can buy additional insurance from, or they'll give you a dental allowance.
without the Advantage plan, but the supplemental plan, do some of them cover? No. So if you want dental and eye, you're going with an Advantage plan.
You either go with an Advantage plan or you can buy a dental plan, a standalone one, separate.
The Joe Namath thing, they'll pay for dental and eye and this and that, they give you money back on your
Oh, those are give back programs. Mainly what he's talking about is
Medicaid?
uh-huh.
Yeah, but they don't say that.
No, and he says he's on the plan or whatever he says. And this plan
I mean,
is
he didn't invest his football money there very well.
no, he's yes, that's what he's talking about in most instances. They do have give back plans, like they may
But it
give you.
wouldn't apply to us.
It might. You could probably get in a plan that would give back to you a little bit of your Part B.
There's
Maybe
an Aetna plan, the credit plan gives you $35 back on your Part B.
every month.
And there's an Aetna Medicare Advantage plan that gives you $1,000 back for dental reimbursement a year, and $200 for eyeglasses.
Oh, that's on an Advantage plan?
Mm-hmm.
Yeah.
Yeah. I can't say because this is a.
Oh, sorry.
That's all right. Don't worry about it.
See, I'm new. Sorry.
But anyway, because then you could do also specific seminars for the plans. That's what most of them do. I don't. I just want to do the
Give me a
educational.
simple, just say A or B, what do you want?
So, and then Part D now has a deductible of $500. I think it's going to 505 maybe. Doesn't matter. And I'll explain a little bit about Part D. Part D is the drug plan. Now, if you just take regular drugs, doesn't affect you at all. If you start taking,
Well, my
So-
husband, the insulin, and he's got so many different, with diabetes, he's got so many different stuff he takes.
yes, so that would affect him, definitely. Because what you do is you can go on Medicare.gov, and we put in all the prescriptions that somebody has, and it actually comes up with the plans that favor those prescriptions, okay? So, you know, Ozempic or whatever, one plan may charge so much for it and the other one may charge less. It's how they negotiated with the benefit managers and things like that, because, you know, they negotiate the rates so that they get, because they're buying in bulk. So that's how they do it. So you wanna check it out and see, because that's if he's on a Medicare Advantage plan, that's part of his plan, is his Part D, and then his doctors and hospitals. So you wanna make sure all of them are in it, so that you can go where you wanna go. Some people are better off in a supplement. If they go to the doctor a lot, the co-pays may outweigh what the supplement costs them. So you have to look at it all which ways. In skilled nursing, in original Medicare, if you're in a rehab center, you have the first 20 days you don't pay anything for. Then after that, you pay $194.50 per day if you're in there longer than 20 days. So that also occurs in a Medicare Advantage plan, the same thing you pay. If you purchase a supplement, some of the supplements will pick up the additional costs. Others will split it with you. You know, there's all different kinds. So you have to go with what your budget is, because you don't want to overextend
So-
yourself.
In the Advantage plan, that's not a supplement
No,
plan.
no. In an Advantage plan, it's not that you've left original Medicare, but if Medicare is paying that company to manage your care. So per person, per zip code, they pay so much, and that's why it goes to CMS, and they note who's in what, and, you know, the payments, I assume, are sent out. I mean, I'm not sure how they do it, because we're not privy to how they negotiate fees or whatever they have. And the Medicare Advantage plans have to be equivalent to original Medicare, and they also offer some additional benefits like eyeglasses and
So do the
some
Advantage
dental.
plans cost more than
No,
regular Medicare?
no.
How do they make money off of that?
Well, they're paid per person, so if they are judicious in their claims and that kind of thing, they make money from each person, because one person may be very sick, right? But other people hardly ever go, so then whatever the government's, and I don't know what they pay them, but I think it's driven on zip code, then,
Well, it tells you when they send you a statement, they say Medicare paid this, and then doctor
Right.
paid that, and what you have to pay.
right. But how the government pays the Medicare Advantage plans, I'm not sure, you know, I just know that whatever they negotiate, I don't know what they pay per person.
So they're paying them to take on the responsibility of managing?
Yes, they are,
Yeah.
are. And a lot of that came from fraud, because we have so much fraud in Medicare. Billions of dollars of fraud. So they felt that an insurance company would be better,
Less fraudulent.
yes, yeah, well, be better at detecting, you know, fraud than the government, so anyway. And that's about it, right? Are we done? This is the Part D, alright. So there's your deductible for Part D, $480. Now, the deductible usually only applies to the more expensive, Tier 3 and above. Tier 1 and 2, which are your generics and some lesser expensive brands, you just pay a copay. If you have a whopper, like, I'm just gonna pull Eliquis, and I have nothing but Eliquis is very expensive. You have to satisfy your deductible in most instances, it's a tier 3 or above. So you pay the first $480 of the cost of Eliquis. And then after that, you're gonna pay a copay, and it's Hi, how are you?
Fine, thanks, sorry I'm late.
That's all right. You're gonna pay a copay. After the deductible is satisfied, and it's like 25% of the cost of the drug, up to, or most of the copays run about $47. And this keeps going on and on and on until you and basically the prescription drug company expend so much money. And then after that, you'll go into what they call the donut hole, and you will pay 25% of the cost of the drug. And then you will come out of the donut hole and you will pay 5% of the cost of the drug. So, and usually during the period when you've satisfied your deductible in your initial period, you're paying for tier 3, you're paying 25% then of the cost of the drug, or the copay. So if the copay is $47, most of them have copays, so they'll just say tier 3 drugs, $47 after deductible satisfied. So you wanna make the doctor aware what they're prescribing you, because they're not aware of the cost of drugs. You know, I mean, they just write out a prescription and hope you can afford it. So,
Can I
yes.
just add something?
Sure.
I was taking a prescription that was $1,500 a month,
Okay.
and I wasn't making a whole lot of money, but I wasn't poor. But I was told to call the company,
Mm-hmm.
and if you call the pharmaceutical company, they sometimes have special plans. I only paid $10
Right.
towards this medication. They did take my Part D and my supplemental, and all I paid was $10.
Right, right,
Until
yeah.
Medicare decided not to cover it anymore.
Oh, then you can't, yes.
Right.
Then, yes. So, yeah, they have to be in these formularies for them. And we often will Google and get people coupons or call and set them up. They have to be under a certain income level, and then they will help you with the cost of this drug that could run $600-700 a month, $1,000 a month. So you need to be aware of that. And a lot of times doctors are just not aware because they're giving you the prescription, they're not taking the prescription, so they're not aware of the cost factor. So we always tell people to ask them, you know, do you have a generic for this? Right? So that's how it goes.